So just to recap, burnout is a syndrome that's made up of three components: emotional exhaustion, depersonalization or alienation, and feelings of decreased personal accomplishment. So burnout has been linked to negative mental and physical health outcomes for staff, high rates of turnover, cynicism and anger among staff, and negative interactions, including potentially abusive behavior with incarcerated persons or parolees and probationers or people on a caseload. So obviously we would like to try to prevent burnout. So there are steps that we can take to decrease the likelihood that corrections officers and other staff will experience burnout. Now, we know a lot about how burnout is caused, but research into the ways that burnout can be prevented is still in early stages. But what research there is points to some very important ways that we could begin to build support into corrections agencies. So working in a prison or in other positions within corrections can be very stressful, and providing different forms of social support at varying levels can help to ameliorate that stress. So social support can be defined as the network of connections that we have with other people that we can draw on for assistance. Now, in the workplace, what social support does is it helps to provide us with the resources that we need in order to be able to deal with stressors. And we can divide social support in the workplace up into three general categories. So the first of these is administrative support, and then we have supervisory support, and we can also think about the culture that exists within an agency, so organizational culture. So administrative support is related to upper levels of management, and this refers to the degree that corrections officers and other staff feel that they are supported. So this can include administration's endorsement of programs, the degree of positive feedback that supervisors and the ground level staff receive, and provision of resources. So administrative support sends a message of respect to employees. Supervisory support is focused on relations with direct supervisors, and it involves staff members' perceptions that supervisors support them. So supervisors can provide support by making role expectations very clear, assist staff in seeing challenges as being rewarding, helping staff members strategize about the best ways to be able to engage in tasks. Right now, sometimes this can be difficult, especially because prisons are bureaucratic institutions, which by nature, right, can have very rigid hierarchies, and they have protocols, right, that have to be followed. But to the extent that there is room for strategy and there's what you might call wiggle room, right, to work with staff, right, to see how best to work within those protocols. And also, supervisory support helps provide staff with the resources that they need to complete their tasks in effective ways. And so what this does is it helps provide staff members with feelings of accomplishment that increase their feelings of satisfaction. So these are some very important practices that have been shown in the literature to increase staff well-being and decrease burnout. So providing staff with very clearly defined expectations and responsibilities and prioritized tasks. So when job descriptions are very fuzzy and people feel like they're constantly under siege, then they're more likely to feel very disconnected from their jobs. Providing a regular amount of constructive feedback. So Garland actually is one of the early scholars on helping prevent burnout. And he recommends that recognition is a powerful motivator. So, like telling staff members that they're doing a good job. Garland actually does a lot of work on how to prevent burnout in staff who work in substance abuse programming in the prison context. So one of the things that he recommends is actually trying to follow up with former clients and to let staff members know about former clients who are doing well in the community now. Because this, like everybody knows about people who are doing badly, right? And the people who they see coming back into the prison, but they don't get to hear about the success stories. And so learning about those success stories can help staff reinvest, right? Providing continuing training is really important. So that helps staff members maintain their skill sets. It helps them feel confident. And this can also include training on how to deal with problematic individuals, how to diffuse conflict, and be able to communicate effectively. And that's really important in the context of a prison where, there is, as I mentioned in the prior lecture on burnout, where there's that fear, right? It's not always stabby, right? Prison isn't Oz. It's not always stabby, but there's that kind of undercurrent in that sort of things might pop off, right? Things could happen. Well, if you feel that you're able to handle yourself, if you feel that you're able to diffuse conflict situations, you're going to feel better, right? And under less threat. Procedural justice. So this involves equitable treatment of staff. Okay? So if you feel that as a staff person, you know what the rules are and that those rules are going to be followed for everybody in the same manner all of the time, then you're less likely to become alienated, right, from your work. So organizational culture is also a key factor in shaping the likelihood that staff will experience burnout. So a really interesting finding is that agencies that have a very macho subculture, characterized by a belief that, just man up and deal with it, right? There's going to be stress, stop your whining, grow a pair of balls. Those agencies have a higher incidence of burnout among their staff. And a qualitative study found that staff in these departments, right, they went and they interviewed the staff. They found that staff in those departments were more likely to deploy transitory coping skills, right? And these were things such as kind of detaching, right? So sort of like mentally going someplace else, right? Using alcohol and other substances, engaging in emotional eating, smoking, right? That made them feel better in the short term, but in the long term weren't very helpful, right? So they weren't able to move into positive coping skills. And so this is a significant concern. So not only does this lead to burnout and high staff turnover, but this also has a negative impact on the lives of the people who are working in the institution, right? And we don't want that to happen. So agencies are trying to figure out ways of building positive and supportive subcultures. So one possible solution that has been suggested is developing peer support teams. So these are made up of specially trained staff members who are supported by mental health professionals. So the idea is that that it's kind of, well, I guess like a credible messenger. That it's, you might feel uncomfortable talking to someone who, even though, they might be a social worker or they might be a psychologist and they're specially trained, but you're like, well, what do they know about where I'm at and the kind of work I do and the stresses that I feel? But there's this person who is doing the work that you're doing, knows the stresses that you're under, and maybe you'll be more likely to speak to this person. So the peer support teams are especially trained in confidentiality, active listening, maintaining neutrality, and in recognizing signs of suicidality and signs of substance abuse. Right? And they work together with mental health professionals. And the staff members are able to seek support from these members of the peer support teams. So this is something that is being tried, I believe, in California. But this is kind of a new thing that is starting to percolate in to law enforcement in general. Right? I think law enforcement agencies and corrections agencies still very much have that, stiff upper lip, you got to be tough kind of ethos. But it's very difficult to maintain, right? And so now we're seeing more we're just starting to see police departments beginning to recognize the need for working with social workers to help maintain the health of police officers. And I'm hoping that like sheriff's departments and departments of corrections are going to start thinking about these kinds of things, right, for their employees as well.